Hi guys, Leon here from physiozone.com, and in this video I'm going to briefly discuss radial pulse wave therapy, or shockwave therapy as it's also known. We're going to go through some of the benefits, also the applications that we use the shockwave therapy for. I'm going to show you a bit of the machine, the different components to it, and then also show you an application of a calf muscle treatment and also a little bit of the Achilles tendon. Now, a lot of times when people hear the word shockwave therapy, they actually think it's an electrical shock being applied to them, which isn't the case. It's actually a sound wave shockwave, and it's very similar to ultrasound therapy treatment, although it's a little bit more aggressive than ultrasound, and you actually can hear and feel the shock waves as it actually penetrates into the skin or into the muscle. So as I said, it's actually a non-invasive treatment, so it's not as aggressive as, let's say, dry needling or acupuncture therapy, but it has a long-term benefit, and it's a lot less aggressive and a lot less painful than, let's say, acupuncture or dry needling. So what I typically use it for is sort of long-term or chronic problems such as Achilles tendonitis or patellar tendonitis, where the traditional physiotherapy hasn't really been that successful in treating. So I find it great for those type of problems. So as I said, it's non-invasive, so it helps with long-term or chronic type of problems. It actually enhances the healing process. So what it basically does is it helps the nutrients feed into the structure or the tendon. So usually tendons are very slow in healing, so what happens with the sound wave, it actually helps to increase what we call the cell membrane permeability. So it allows the oxygen and the nutrients actually to enter into the cell a lot easier, and that then obviously helps speed up the healing process. So it also helps break down old and damaged and weakened cells, and it helps to remove some of those excess cells and waste products, as they call it, and replace it then with healthy and viable cells. So neurologically, the shockwave actually produces a decreased pain signal, and that then helps to close what they call the theoretical pain gate. So it helps with a bit of pain gating modulation. There also, in terms of the cell itself, there's also a change in terms of the vascular, the oxygenation of it, so increased blood circulation, and then obviously also oxygen feeding into the cell as well. So it also helps a little bit with reducing the carbon dioxide concentration in the tissue, and then that also helps then stimulate the healing process itself. So it helps to not only increase cell permeability and also increase nutrients to it, but then it also helps to control the muscle tone and spasm that's actually in the tissue itself. So as I mentioned briefly, there are a few applications that I would actually use it for. It's very good at deactivating what we call trigger points or local areas of muscle spasm, and that could range anything from a calf, low back, hips, glutes, or even I find it very good for upper neck tension, people with tension, headaches, that sort of stuff. So I find that really beneficial for that. You also have different applications, so sometimes you might have sort of a pulse vibration massage applicator that you can also use for more sort of low-key massage. It's very good for stuff like plantar fasciitis. I see a lot of people who've done all the chronic treatments like acupuncture and deep tissue massage, and they've had orthotics fitted, and we've actually then been able to help them with